All right, let's go ahead and get started. Thank you for joining us this morning. As you enter the room, you will notice that both your audio and video are muted. Please use the Q&A at the bottom of your screen for any questions that you have to be considered for our speakers. You can also communicate with the hosts using the chat feature. This webinar is being recorded, and you will receive a link to the recording in your post-event email. I'm Joanne Kaufman, the Community Engagement Manager for the Minneapolis Chamber. And with that, I'm going to turn it over to Christina Palladino, Senior Principal with Park Street Public. Christina, it's all yours.
Thank you so much, Joanne, and thank you everyone for joining us this morning on this webinar, the OffRamp Project, a holistic approach to gun violence prevention. Again, my name is Christina Palladino, Senior Principal at Park Street Public. I do media relations and public relations for our firm. In a prior life, was a TV news journalist for nearly 20 years. So it's just great to be able to use those skills and facilitate this conversation for the next hour. First, I want to introduce our expert panelists, Dr. Jillian Peterson, President and co-founder of the Violence Project, also an associate professor of criminology and criminal justice at Hamline University in St. Paul. And also we have joined with us Dr. James Densley, President and co-founder of the Violence Project as well, and professor and department chair of criminal justice at Metropolitan State University. I'm going to hand it over to both of you to do a little further intros and present your presentation.
Hello, everybody. Thank you so much for being here with us today. We sincerely appreciate it for this important conversation. I am going to share my screen because I have a few slides that I'd like to present here. Hopefully you can all see that. Does that work? Okay, brilliant. So here we are. We're here to talk about what we're calling the OffRamp project, a holistic approach to violence prevention. Before we dive into what that actually means and what we are doing here today, Jill and I just wanted to provide a little bit of background on our work so that you understand kind of where we're coming from with this conversation. So I'll let Jill start with that.
Hi, everyone. So I am Jill. I actually started my career before I was an academic. I was an investigator. I worked for the New York Capitol Defender's Office, and I worked investigating the life histories of people that were facing the death penalty in New York City, and spent a number of years doing that and really trying to understand the pathway to violence. So how does somebody get to the point of committing murder, and what does that pathway look like? So that's the perspective that I really bring to this work, is that sort of if we're going to prevent gun violence, we have to actually understand the root causes of where it's coming from and how complex that pathway is that people are on to get there. I'm a psychologist by training, and my sort of areas of expertise are mental illness and crime, mental illness and violence, and then sort of mass shootings, school shootings, and holistic violence prevention. And then I'm also trained in suicide prevention and crisis intervention.
And as Jill is a psychologist, I am a sociologist by training. And so I am looking less from the kind of individual perspective and more from that societal perspective. In a previous life, I was a middle school special education teacher. So I also come at this work as a practitioner from having worked in the public school system. I actually worked in the New York City public schools in the South Bronx, which at the time was the poorest congressional district in the country. And it was actually that work that got me interested in violence prevention. So for over a decade, a lot of my research has actually been looking at gang violence and urban violence and looking at solutions to gun violence every day in our communities. And I made that pivot to look at sort of mass shootings, school shootings, and other issues just in sort of recent years with the project that we've been working on, Jill and I together. So the first thing we want to do here today is just to put some of the sort of context around what you've been hearing about violence in Minneapolis and St. Paul, and to really highlight that gun violence is a complex problem that's going to require multifaceted, customized solutions. When we think of gun violence, there's really not one form of gun violence, but multiple forms of gun violence. And even on this screen right here is not a complete list. You have, for instance, suicide perpetrated with firearm. You have everyday homicides perpetrated with firearms. That is really the focus of some of the work that we're going to be talking about today. We have domestic violence perpetrated with firearms. We also have public mass shootings that occur in workplaces, schools, churches, and other locations. Every single one of these is a tragedy. Every single one of these is preventable. And every single one of these has a slightly different profile when it comes to the offenders and also the victims. And it's understanding the subtle nuances between these different types of gun violence, which move us closer toward holistic violence prevention. It's not going to be a one-size-fits-all scenario. We have to understand that different problems need different solutions, but they are all important. So, when we look at the current circumstances here in the Twin Cities, this is really the key takeaway that I want to flag for us today, which is that the murders in the Twin Cities are up. Last year was an exceptional year. It's not just a media hype. It's not just the odd case here or there. This is real. It's a real thing. That feeling you're feeling is real. In addition to this, I want to highlight that in raw numbers, the 74 murders that we had in Minneapolis last year bring us to levels that we've not seen since the mid-1990s. That's the red dotted line on your screen. If you track back, you'll see that we have to hit 1995 when was the last time we had numbers that high. Now, of course, most people would say, but wait a minute, more people live in the Twin Cities today now than they did before. But you can even control for population size and show that this is not an anomaly. Twin Cities murder rates, and this is when you control for per 100,000 residents, are also elevated. They are elevated to levels we've not seen since 1995. And 1995 was notable, by the way, because that was the year that the New York Times described Minneapolis as Murder-apolis. So we're seeing levels we've not seen for some 25 or 30 years, which is quite alarming. But this is also a national trend. It's not just here in Minneapolis and in St. Paul where we're seeing rising gun violence. We're seeing it across the country in our urban centers, which suggests that there's something bigger going on than just what's happening here locally. Just want to flag as well that we only have data going back about 5 years for this because it hasn't been tracked as long, but non-fatal shootings are also going up. This is also alarming because our medical technologies are better now than they have ever been. And so many of the people who have lost their lives, at a time when our medicine is better, we have also individuals who survived shootings. And this means that we could be looking at even higher homicide rates had it not been for the hard work and dedication of our first responders and our medical professionals and the technologies that we have that are saving lives at this moment. So what accounts for this? What's happening? As I mentioned, it's a national level trend. Well, one of the main factors that we see is rising levels of guns that correlate highly with gun violence. We have seen record gun sales in the last 12 months, and we actually see historically that there is a trend around gun sales, which is during times of uncertainty, during times when our political situation or our social circumstances are such where people are concerned about what is going to happen in the future, people turn to guns as a source of protection. Of course, guns intended to protect are liable to endanger, and they fall into the hands of individuals that shouldn't have guns. The scary thing about the rising number of gun sales is that many of these individuals are first-time gun buyers. These are individuals that maybe don't have the skills necessary to be handling weapons in such a way. What other mechanisms are at play? Well, related to the more gun stuff is, of course, last year was a global pandemic. I want to flag that it was a global pandemic, which means it affected all of us across the United States, which might explain why people are turning to violence now, because the pandemic disrupted our livelihoods. It disrupted our ability to intervene with violence because our schools were closed and our after-school programs were closed. But at the same time, a global pandemic, you would think, would then manifest itself in global rises in violence. But that's something that we're actually not seeing. The United States is a little bit of an anomaly with this. And that perhaps speaks to a couple of other things. That the United States does not have the social safety net of the other developed nations across the world that have been dealing with the same global pandemic. And that the United States has more guns than the rest of the developed world that was dealing with the pandemic. At the same time, here we are here in Minneapolis and St. Paul, which has been the epicenter of the debate around racial justice in the aftermath of the murder of George Floyd. So we're also seeing a diminished trust in our institutions. We are worried about the role of the police in our community, and this perhaps has resulted in a depolicing that's going on, where the police are responding to crime, but perhaps doing less proactively. Some of that is tied to the pandemic. Some of it's also tied to the fact that the Minneapolis Police Department has 200 less officers now than it did a year ago because of the number of people who've left the profession, given the environment that we're operating in right now. And then, of course, tied to that diminished trust depolicing piece is the media and social media kind of echo chamber around the ways in which we're just really angry with each other right now. If you have to look back at the Capitol, storming of the Capitol back in January, and the way in which our political discourse has become so divided, we are in a situation where we are just angry at one another. And it's easier for people to reach for their guns when they're angry and take it out on one another. So there was a lot of sort of unique, interesting things that are bubbling up right now, which are preventable, but we have to understand where they're coming from if we're going to do something about it.
So through our research, our deep dive initially for the last few years have been into the life histories of mass shooters. And this is kind of the 4 commonalities that we see when we've looked at 175 different perpetrators of mass shootings. And we did this by building a database, which I'll discuss in a minute, and also conducting dozens of interviews across the country with perpetrators of mass violence, with people who knew them, with victims, and with first responders. This model also applies to other forms of gun violence that James initially discussed. So the first thing we see is childhood trauma. Amongst mass shooters, that early childhood trauma is really pervasive and really severe. We can also think about trauma when we talk about, say, domestic violence, where we know that perpetrators of domestic violence are often have been victimized early on in their childhood. And when we talk about sort of community gun violence, the trauma that communities are living with at that level in terms of the fear that comes with living in a neighborhood that's sort of entrenched in that level of murder and violent crime. We know that perpetrators are often in crisis. So when we look at mass shooters, we see this consistently. It's one of kind of the main predictors. And we define a crisis as when your own coping mechanisms are overwhelmed. So the circumstances of what's happening overwhelms your coping mechanisms. That could be because of mental health. That could be because of a job loss. That could be a relationship. It could be situational. So we see that for perpetrators of mass shootings, especially in workplaces, it's oftentimes being fired or being suspended, and it becomes a suicidal crisis. So that perpetrators of mass shootings, they don't typically have an out plan. They intend the mass shooting to be their final act. And so they're actively suicidal prior and during the shooting. When we look at community violence, we also see perpetrators being in crisis, kind of hitting this breaking point. It's not necessarily actively suicidal, but there's definitely a hopelessness that comes along with engaging in community violence and retaliatory violence. And we know that the pandemic has pushed a lot of people to this crisis point because of job loss, because because there hasn't been school to keep people busy, because of lack of supervision, because of just stress and grief, that a lot of people are being pushed to this crisis point, which can boil over into gun violence. The third piece that we see is social proof. That violence is kind of scripted in our culture, and that perpetrators follow this script. So for mass shooters, they often study other mass shooters. They get radicalized online, in chat rooms, and on other social media forums. And that we see that this sort of quest for notoriety that a lot of mass shooters have, that they are looking for their message to get out there and go viral. Other shooters see that message and sort of see themselves in them and emulate it. Social proof is kind of different for other forms of gun violence. So for community-based gun violence, this script is more in the neighborhood, so that these are a lot of young people who are sort of functioning within these neighborhoods where violence is maybe a bit more common, or they've been sort of brought into social groups where retaliatory violence is just sort of more part of the experience that they're living from a very young age. And for domestic violence, we see that the social proof is oftentimes generational, where sort of victims become perpetrators as they get older. And then there's opportunity, so that mass shooters have the ability to carry out their crime. For mass shootings, this is often access to the place that they want to do the mass shooting, whether that's a school or a workplace. It's also access to weapons. And for mass shooters, that's typically guns that they're obtaining legally. For other forms of gun violence, it's illegal gun ownership. But we know that regardless, gun violence requires access to weapons. So when we talk about for risk factors of kind of all forms of gun violence, when we think about holistic gun violence prevention, it's about thinking about what are the root causes of where this violence is coming from. So we know that these are risk factors, things like feeling disconnected, not having a good social support system, feeling lonely, this hopelessness feeling that there's nothing sort of out there for you beyond this. Fear, family conflict is a major risk factor, transitions, whether that's returning to school, returning to work, leaving school, leaving work, and then just the stress of current events, whether that is things like the murder of George Floyd, the recent elections, just the global pandemic. A lot of these risk factors have been exacerbated during the last year, this disconnection, this loneliness, and this hopelessness. So when we talk about holistic violence prevention, we are not thinking about things that are about kind of responding to violence when it occurs. So a lot of times when we think about what we've been doing to prevent mass shootings, it is, say, running people through drills and increasing security. That's about minimizing casualties, which of course is important, and we want to be able to do that. But our sort of focus is not on policing, and it's not on security cameras, and it's not on bulletproof glass. It's thinking about things like mental wellness, thinking about things like trauma-informed care and trauma-informed practices, thinking about things like crisis intervention and suicide prevention. So it's looking at the complete systems of pathways and precursors to violence, and then figuring out where we can effectively intervene as individuals and as institutions, and then also at the policy level. So like I mentioned, for the past 3 years, we have been building this mass shooter database with a grant from the US Department of Justice. The mass shooter database is available at theviolenceproject.org. You can download it, and it's been used thousands of times by policymakers and journalists and just people generally interested in the data around this issue. And from that research, we have developed off-ramps. So off-ramp, and I think James will show the actual website in a second. The idea around off-ramp is that the road to violence is long, and we can build different off-ramps. So off-ramps is focused on training and on resources and on policies to help people get off that road to violence. And we see as a lot of these practices really having a diffusion of benefits. So we come at this work in terms of studying mass shooters, but a lot of these practices, things like trauma-informed care, crisis intervention, suicide prevention, they may help prevent mass shootings. They can help prevent other forms of gun violence. They can help prevent domestic violence. They can help prevent things like suicides and self-harm and drug overdoses, which we also have had an epidemic of in the last year. That a lot of these outcomes come from a similar place of kind of pain and crisis, that if you can address those root causes, you see the benefits diffuse across society. One thing that we found through our research is that a lot of things that we've been doing to prevent mass shootings and other forms of gun violence are just not working. So things like drills and hard security are not very effective, especially for workplaces, because the perpetrators of workplace violence are almost always employees of that workplace. So they're insiders, not outsiders. They're people who know how to go through the security and are very familiar with it, which is harder to prevent that type of violence. We know that punishment doesn't work, whether that's suspending or expelling someone from school or criminally charging someone or firing them. When someone's in crisis, that type of response can really exacerbate the crisis and make violence even more likely. We've done some research that shows that when it comes to school shootings specifically, armed officers are also ineffective. And in fact, they actually increase the casualty count in some of these mass shootings because individuals are actively suicidal, that somebody with a weapon can actually be an incentive to commit the shooting rather than a deterrent. We know that perpetrators study other perpetrators, and so that's something that we need to be looking out for. We know that cultures of silence are contribute to the problem, and that we really need systems that allow people to report. And then we also know that perpetrators tend to leak their plans ahead of time. So they tend to tell others about what they're planning. And if we can sort of increase people feeling like they can trust others to talk about what they're seeing and hearing, and they can trust the response, that's going to be helpful. So similar to what some of the things I just said, what we know will work is that if we think of perpetrators as shooters that are employees and students of our institutions, they're people that we see every day. That allows prevention to actually be a lot more effective. We know that a lot of shooters are in crisis, and so things like crisis intervention and crisis response teams in our institutions, whether that's within workplaces or churches or schools, can be really helpful, and we have those resources on our website. We know that things like training employees and training all of us really in suicide prevention skills and crisis intervention skills can help identify individuals that can be struggling and sort of build confidence in knowing how to respond and ask those questions and what to do with that information. We also can look for warning signs, and we know that leakage, when someone's sort of indicating that they might be thinking about violence, that becomes a really key intervention point.
So Jill had just mentioned that we developed a kind of spin-off website from the Violence Project known as OffRamp. And OffRamp is a hub for training, information, and resources for anyone who's really interested in preventing gun violence. The initial focus was on mass shooting prevention, but we started to realize that with this diffusion of benefits, there was so much overlap that it had application elsewhere. So at the offramp.org, you can download a lot of our research under the resources link if you're interested in the peer-reviewed articles that back up some of the things that we've been talking about today. But also under the resource link, we have a state-by-state and national database of all advocacy and crisis intervention, mental health resource and service providers who are out there. We have their numbers, their email addresses, literally for all 50 states, but also national providers too, as a sort of hub so people can go and find what's out there. We actually had a team of interns call each and every one of these institutions to get their permission to be on the website, to check their availability, their hours and other things as well. And so it's all there on the website. We have online training in crisis intervention, de-escalation. We are in building a sort of positive climate within a workplace, but also in schools. Violence prevention within workplaces, suicide prevention, and other things as well that's available. And then we also have downloadable for free protocols on how to build what we're calling crisis response teams, which is a sort of softer way of thinking about threat assessment, if you will. When we think about building crisis response teams, these are multidisciplinary teams that work in schools and in workplaces to identify threatening behavior. But what our research is telling us is that it's not just threatening behavior that's indicative of potential violence. We're also trying to identify the signs that somebody is in a crisis. And this means a marked change in baseline behavior. And it could be that you've got somebody in your school or in your workplace that's always a little bit angry. Well, if they're always angry, then that's not a change from baseline behavior. But if all of a sudden somebody who's really angry comes to work one day and is really happy, that would be a change in baseline behavior. And it might be indicative that something else is going on. It could be positive, it could be negative, but you might want to know. So what we have is a step-by-step protocol designed for workplaces and for schools in terms of how to build these crisis response teams, how to do the right training to ensure that they're successful, how to build all the protocols around it. All the forms are there and they're all downloadable off of the website. Now, the other thing as well is, as we mentioned, a lot of our work has focused on mass shootings in public spaces, but for a long time, we've also been focused on work around violence prevention in everyday spaces and in everyday life. And one of the big questions that's being asked right now, right here in the Twin Cities, is that can we have violence reduction initiatives that don't rely solely on law enforcement? This is a huge conversation going on right now in the Twin Cities. There's been a lot of academic research which has highlighted what they think are going to be the most successful strategies for violence prevention. So here are some of those suggestions that came out of this kind of John Jay College in New York and other people who got together and looked at the evidence. The first is place-based interventions, essentially trying to design out crime by making our public spaces more accessible for individuals. So the things like, building better pathways through our towns, parks and public spaces, taking abandoned lots and turning them into community spaces where people can hang out, all that type of stuff actually really helps to reduce violence. Secondly, we have to break down the kind of the code of the street, if you will, that suggests that retaliatory violence is the way to go. We have young people at the moment who are shooting each other, and then people are shooting back. So this is where you get those violence interrupters, models like the Cure Violence interruption, where you have people on the street with credibility who are able to actually intervene in the violence and stop it from ever occurring. We know that the violence we see is youthful. So young people, if you think about what we call in criminology, the age crime curve, the vast majority of people age out of crime. And even if you look at your own lives, you can probably think about the time when you were a teenager and you were doing things that you shouldn't have been doing. Now, that doesn't necessarily mean that you were shooting people, but that does mean that you were probably engaging in some delinquency, but you grew out of it. The same rules apply for this. We absolutely have to engage and support our young people. This crime is youthful, which means we've got to do something for our young people to stop them engaging in the violence. Other things that are tied perhaps with the pandemic and some of the other factors that Jill was talking about earlier, reducing substance abuse, mitigating financial stress, these things will also really help in a sort of exacerbating and getting rid of those tensions that may result in violence. We need restorative practices to ensure that people are being reintegrated back into their communities, which is vitally important. And then the bottom line is, the more ready access to firearms that we have, both legal and illegal, the easier it is that they are going to fall into the hands of the young people who are out on the street shooting each other today. So the things that we can do to tackle, for instance, delinquent gun dealers who are not doing the background checks that they should be doing, and getting those guns into the hands of young people. Disrupting the gun markets is really important for reductions in violent crime. Resourcing our ATF and other agencies that can do this type of work is vitally important. So that's our lead in for now, but we have tons of time for questions because that's how this was designed. And so all I would say is that if you're interested in our work on mass shootings, we do have a book coming out on September 7th called The Violence Project, How to Stop a Mass Shooting Epidemic, available at all good bookshops. And these are the links to the OffRamp project and the Violence Project there. And if you want to get in touch, we're on social media at The Violence Pro. And that's our email address is admin@theviolenceproject.org. So thanks for that. And we'll hand over to Christina for questions.
Great. Thank you so much, James and Jill. And for folks tuning in, feel free if you have a question to put it in the chat. We're monitoring them and we love to really get, engaged with our audience. So definitely send a question. So you guys did a phenomenal job, as always, walking us through and really kind of diving deep into the numbers and the reasons and the approaches behind what we're seeing right now. So, of course, we are coming out of a 1.5 year long pandemic. The Twin Cities was, of course, the epicenter of racial reckoning. It's essentially a recipe for gun violence and crime that we're seeing here in the Twin Cities and nationwide. What's the very first step we can take to start reducing these incidents in our communities?
Do you want to go, Jill, or me?
Go for it. I'll follow up.
Well, if you think about the first step is really truly acknowledging and recognizing that there is a problem. And unfortunately, what often happens with gun violence prevention projects, no matter what they are, is we recognize there's a problem. There's a kind of immediate knee-jerk reaction as a solution, but then it's not sustainable going forward. And even the best intervention projects that after 6 months, the funding dries up, attention focuses elsewhere, the media is not talking about it anymore, and we all move on. And then we wonder why a year from now, violence goes back up again. And it really is a case of sustainability. It's whatever we're doing can't be a quick short-term fix. We have to be in for the end game, the long game with this. So the first thing is acknowledging the problem, which gets people on board to recognize that we need a solution. But it's also making sure that when we do it right. And that means committing to long-term, sustainable funding and solutions. The one thing that I think is really tricky with a lot of this work is often we'll throw money at nonprofit organizations to intervene with violence, but it's not sustainable. Like there's not enough programs and organizations to do that work into perpetuity. You fund somebody for 6 months. What happens in month 7? And so I think that's what we really we need to be thinking about is like acknowledging the problem, but then recognizing we need that big strategic view that this is long-term and it's sustainable. And you really want to put that emphasis on the prevention piece, because that's where that sustainability comes from. You're trying to prevent so that the future violence isn't there. That's really the key. And I know Jill's got something to add to that.
Yeah, I think I come at that question as a psychologist, right? I think, okay, so I think there's all sorts of things that are the pandemic really exacerbated. We have gun violence happening in our communities. We have domestic violence. We have mass shootings. We just had the worst spate of mass shootings we've had in a long time. We have, drug and alcohol use, and we have mental health concerns, and we have suicidality. And I think as we reopen our institutions, especially thinking about schools, workplaces, places of worship, community centers, how do we make sure we're building these really warm, welcoming environments to welcome people back in, that have space to check on people's well-being, that have systems to report if you're worried about somebody, that person's going to respond with care and concern instead of punishment, that this is a moment where we really have to take care of each other and build institutions that can do that work.
Yeah. Well, that segues perfectly into my next question. You talked about how we're all starting to go back to the office. Most likely, students and college students will be going back to school in person. Talk about why this could be a pivotal moment to really change the way we think about mass shootings, we protect ourselves, and we approach this epidemic that we have in the United States differently this time.
Yeah, I think so. For the last, 20 years or so, probably since Columbine, our approach to stopping mass shootings, preventing mass shootings, has been to try to really secure our institutions, right? So bulletproof glass and security cameras and armed officers, and to drill ourselves so we know how to respond when it happens. And I think we're at a really critical moment right now in society where we understand a little bit more about this phenomenon, that these are not just scary monsters coming from the outside. Our students and employees of our workplaces, of our schools, that are insiders that we see every day. So these aren't people we can sort of block out with big walls. These are people that are going in and out of those walls every day. And so both we understand this problem more, and also I think we're really ready to start thinking about root causes of violence, that it's not just about kind of policing and arresting. It's about, where is this phenomenon coming from? How do we recognize this pathway? How do we recognize the early signs? And then how do we intervene before someone ever enters a building with a gun? And so I think that shift from sort of hard security to crisis intervention and mental wellness is a really important shift, especially, and this pandemic really made that all the more important.
Do you feel like we're kind of slowly but surely making steps to incorporating more of what you all have researched and talked about in your OffRamp project, that holistic approach? We are starting to hear more about, the mental health and the trauma enforced, counseling and reaching out. Do you think we're kind of getting there? What else needs to be done to incorporate more of that holistic approach into how we solve these issues?
Yeah, I'm optimistic, because it does seem like there's some traction behind that now, and you do hear it more and more. People talking about trauma-informed schools and workplace violence prevention that's more holistic and focused on mental health and wellness. I think for us, it's one of the reasons why we actually built the OffRamp website. What we were hearing from practitioners was that they heard the buzzwords, they knew they needed to do it, but they weren't quite sure how. It was sort of like, we know we need to do it, but how? How do we do it? And also, how do they get the space to do it well? So it was a case of, for school teachers, for instance, it was like, this sounds like yet another mandate that I'm going to have to add to. I've got to teach the kids reading and writing and everything else. And now I've got to do suicide prevention as well. Like, there's not enough hours in the day. And so one of the reasons we went about building that crisis response team protocol and putting it on the website was, here's the step-by-step guide of how you do it, of how you have those conversations in your school so it doesn't feel like extra work. Same in workplaces as well. How do you do it in a workplace that it doesn't feel like extra work, it doesn't feel punitive, but also that you have the resources you need to ensure that it's successful? And carving out that space in the day that you've got the team that can work on this project, that it doesn't feel like extra work. It actually just feels part and parcel of your day. And ensuring that we had the protocols that you could just sort of download and fill in the boxes. Because that was the other thing. It was like, well, do we have to create the forms? Do we have to build the whole ecosystem and the infrastructure around it? And we work with the Minnesota School Safety Center. We work with the United States Secret Service. We work with other sort of service providers out there to sort of say, well, what's working across the country? Let's take those best practices. Let's distill them down into something that can be used and literally can be just like taken off the shelf and implemented tomorrow. And that was the goal with that type of work. So the short answer to your question is very optimistic. Everybody seems to be sort of turning a page and is on that same page. But the big question now is how? How do you do it? And we're hoping that this resource can kind of get people there.
Yeah. Well, let's take a question from one of our audience members. Are there other big factors missing in the United States that limit violence in other countries besides gun ownership and social safety nets?
I mean, those both are pretty big. I mean, when I think about social safety net, and I say this with my best British accent, you know, I grew up in the United Kingdom. When I think about a social safety net, you know, it is universal healthcare. It's paid maternity leave that is, you know, 12 months long in some cases. It's, you know, free childcare. It is a big swath of things. But you think about how those things, you know, can exacerbate the risk factors of families who are in poverty or dealing with issues. They are really, really important in those ways. And so I do think that that is quite unique. The only other thing I'd add as the kind of sociologist here is there is a sort of, and Jill alluded to it with the kind of the 4-step model that we've developed here, that cultural script or social proof, I think is different in the United States to other countries, where all countries have a history of violence, and in many cases have a history of institutionalized violence as well. But there is something quite unique about the United States, the way, if you look at its history, that violence has become so ingrained in everyday life. And I feel like that is a contributing factor to how easy it is for people to resort to violence, to resolve their conflicts, whereas perhaps in other locations that they would look about it differently.
And I would just add also, I think, you know, politically, we know that there are peaks in gun violence when people have a distrust in their leadership. And we saw during the 4 years of the Trump administration just a real divisiveness in this country. And during that same period of time, we saw a rise. Those are the worst years on record in terms of mass shootings, and specifically hate-driven mass shootings. And so I think there is this sort of political culture that we've been living through of divisiveness and anger and fear and hatred that is kind of uniquely American for the last few years.
Yeah. I want to take one more question that I really liked. With employees and students coming back, some level of security provides peace of mind. How do you balance the needs of people in crisis versus the needs of others to go about their daily business? I really like this one.
That's a great question, right? Because no one wants to live in a police state, but it's always that sensitive balance between liberty and security, right? It's like it's literally the quintessential American question, is what that gets to the heart of. And I think what it comes down to is you can find ways to, even those individuals who are in crisis, to think about how we're going to integrate those individuals back into our community or in our society, so that we're not ostracizing them and making them feel other or different. I think that's one of the key things. Is what we've done historically is we believe that we can just punish our way out of this problem. So we'll exclude someone, we'll suspend somebody, we'll fire them from the workplace, and we'll say, okay, well, that's it, they're not our problem anymore. But unfortunately, what the evidence tells us is they are still your problem, because now the grievance that they have is targeted right back at the workplace or at the school. So that step of what feels like increasing safety and security actually has decreased it. So for the employees now there, they become sort of collateral damage, because that individual is now angry at the workplace or at the boss, or is angry at the principal and at the school, and is channeling that and that grievance toward them in those ways. So I think that's the the really tricky, sensitive balance here, is how are we doing this in a way that even if you do have to fire somebody, let's say, how are we doing it in a way so that it comes off that that individual leaves that meeting and that conversation feeling like they've been treated with respect, dignity, that even if they're angry that they've been fired, that they're not looking back at the workplace as the source of the problem, but more that the workplace is trying to kind of support them in a way that is reintegrative in that sense.
It's such a good question. And I think we talk to principals and we talk to employers and we talk to people who say, like, my employees, my parents, my students, they need to feel safe, right? It needs to look safe. I need to do something so they can feel it and they can see it. And so it's a metal detector, or it's a police officer at the door, or it's fancy new security systems. I mean, it's the school safety industry is a $2 billion industry that we spend on this because it looks safe and it feels safe and we feel better. But the reality is, it doesn't work, right? Because if there is a threat, it's a student in that school every day. And if there's a threat, it's an employee of that workplace is the most likely person. So I think it's kind of shifting that mentality, and not to say you have to completely do away with metal detectors. I think you can have metal detectors, but how do you also create these warm, welcoming systems so it doesn't feel like that is taking over? Because that can feel very cold, that can reduce reporting, that can make people feel unsafe, that can make relationships feel strained. So how do you, at the same time, making sure that you have these environments where people feel like they can trust each other, where people feel like they can report, where people feel like their mental wellness is taken care of?
Well, let's dive deeper into how do you spot someone in crisis? How do you get to them early on? Obviously, from news coverage over the years, your research and reporting, almost every mass shooter or somebody who's committing crimes just, on the street, they were in some sort of crisis. How do you kind of begin to take those steps to intervene in a way that's, respectful and, kind of putting one step forward and reaching out?
It's a good question. So someone in crisis, there's no kind of one sign that someone is in crisis. A crisis looks different for each person. What we do know is a crisis is a marked change in someone's behavior. So if someone is generally a fairly quiet person and is now acting out and being aggressive, that's a change, right? Or if someone's really kind of gregarious and outgoing and it's suddenly very quiet, that's a change. So you're looking for a change. It can be isolation, it can be aggression, it can be changes in sleeping or eating, it can be not showing up to work and suddenly you're late every day and you haven't been late before. But it's some sort of change in behavior. And then we've developed this kind of 4-step protocol around crisis intervention that the training is on our website and also some handouts about it. But it requires, the first step is kind of yourself, kind of de-escalating your own self so that you're in the space to be able to de-escalate someone else and to be able to do crisis intervention work. Sometimes we skip that step and it's actually super critical to make sure you are in the space to be able to do that at the moment. The second is focused on kind of de-escalating the space and the environment. The third is nonverbal strategies, which are incredibly important in terms of what you do with your body. And then the fourth is kind of what you say, the questions that you ask, the things that you focus on, focusing on feelings, giving a couple of options, and then how to connect that person with resources afterwards. I like to think of crisis intervention, I say it's like CPR, right? It's a very specific skill set that we all should have because it can actually save lives. And it takes 10, 15 minutes. And sort of the more you do it and the more you rehearse it, the more comfortable you get with it.
And we all, just kind of a follow-up question, I mean, we all hear of this see something, say something campaign, that was implemented really kind of after 9/11. Do you feel like that's been effective, or do we need to, take another approach or kind of level that up a little bit more?
I think the challenge that we have is, I agree with it. I think it's a good thing. See something, say something. The challenge at the moment is it's say something to whom. And so sometimes it's very unclear who the somebody is. And often we have made that somebody law enforcement. And, and in the context of 9/11 and terrorism, that makes perfect sense, right? I mean, if you see a bomb on a train, like, you're going to call 911. That makes perfect sense. But in this case, if it's like, I see a student who's just off, right? That shouldn't be a call to 911. But unfortunately, we haven't really built the infrastructure around this of who are we reporting to? Who is the delegated person who's going to deal with this? And is also going to deal with it in a way that is sensitive and is not just punitive to the issues that are going on. That in turn ties into the broader conversation we're having right now about diminished trust. Because if the see something, say something is, and that say something has to be 911 and call the police, at the moment where you've got such a trust deficit between the police and the community, people aren't calling the police. I mean, they're not even calling the police when there's a homicide in a community because the diminished trust is so great. And part of that as well is the fear within the community of what that response from law enforcement will look like, but also what will the retaliation be if I involve law enforcement? So we really have to take that step back and say, a lot of this is around building trust within our institutions and within a society with law enforcement, but also with our schools, our workplaces, so you can trust the process. But then it's also around building those ready alternatives so that once you've said something, somebody's going to do something. Because unfortunately, people feel like, okay, I saw something, I said something, nothing happened. So it's really putting that next stage in place, which is somebody's got to do something. And then I'm going to trust that this is going to work. And that's really the most important thing. So building those crisis response teams in our schools and in our workplace is really about building those bridges between law enforcement and the community. But it's also really about ensuring that somebody really does something and what they do is going to work. It's not just going to make the problem worse.
Yeah. And that brings us to the defund the police conversation. You know, in my reporting here in the Twin Cities, a lot of times these incidents started off as a person in crisis. You called 911 or police, an officer shows up. They may not be equipped to handle somebody having a mental health breakdown. So how do we figure this conversation out? There are valid viewpoints on each side. There's a lot of communities that are in trauma from interactions with law enforcement. In your nonpartisan perspectives, how do we figure this out and get some good working solutions?
You know, James and I have done quite a bit of training with law enforcement and spent a period of time going on ride-alongs and kind of developing some new trainings and trying to really dig into what this looks like. I think one big issue when we talk to police is that the police have very few options at their disposal when they show up, right? They can arrest somebody, they can potentially hospitalize them, and they can walk away. That's kind of it. And a lot of times it can escalate into force, right? But we know that's really the tool set. And a lot of times, a lot of these situations, none of those are appropriate responses. It's not, the person doesn't need to be arrested. They don't need to go to the hospital, and they don't need somebody to walk away and do nothing. They need something else, right? And that something else is what's kind of missing in our current structure. And so we've focused on, can we build that something else into schools? Can we build it into workplaces? Can we build it into other institutions? So if somebody needs something, they need connection to long-term resources, we don't have to bring in the police in order to make those connections to long-term resources. We have systems in place, that referral systems, that we can actually be the people to be making those referrals. Same thing with sort of skills in crisis intervention, skills in suicide prevention. I think there's a lot of crisis situations where people panic and they don't feel like they have the skills necessary. And so law enforcement has become just the first responders to all of those situations, whereas we need different first responders to handle a lot of those crisis situations.
And the only one other thing I'd add to that is, you know, when we think about defunding the police, the vast majority of police budgets go to salaries, they go to benefits, they go to overtime. It's personnel, essentially. So in some ways, we've already kind of defunded Minneapolis because they have 200 officers less than they had before. And what we've seen with that is clearance rates for violent crimes have gone down and so on and so forth. So part of me thinks with this conversation, we've created a false dichotomy, right? It's not a case of defund the police so we can fund public services. It's the case that public services have been defunded for 50 years and we need to fund them. So I think some ways the defund the police thing, why I think it gets such a visceral reaction from people, you either love it or you hate it, is actually because people don't fully understand what that messaging is sort of saying. I don't think we have to defund the police to fund public services. I think the message is fund public services. Stop defunding them because they've been defunded for generations. That's where the money needs to go to build exactly the systems that Jill was just talking about. So those alternatives are stood up and they're available. Because that's the other risk here is, okay, defund the police, but we can't wait 5 years to build a mental health hospital. Like, we need that now. So that funding has to be there and in place now so that we can transform public safety in that positive way. So it's really a case of ensuring that they have the supports that they need.
Yeah. Well, let's kind of wrap up here. We're getting close to the end of the webinar. It's been such a great conversation. I always like to just kind of ask, where do we go from here? Is it public policy and laws? Is it, better training and more money? Where do we kind of take our next steps to really, get this all together and moving forward?
So James and I, in our work, we kind of think of prevention intervention at 3 different places. I think a lot of times we get caught at the policy level, which is super important, and we need policies. But it can feel, I think, disempowering if you are somebody who doesn't work at the Capitol and who's not a lobbyist, and what can I really do, right, if I want? And so certainly we can push for policies that support holistic violence prevention efforts. I think also, as institutions, there's more that we can do. So as schools, as workplaces, as churches, what can we talk about in terms of building crisis response teams, training people in suicide prevention, making sure we have trauma-informed practices, getting the training, making the connections to community services that we need to make so we can make referrals. How do we really build those systems? And then even as individuals, there's so much that we can do that I think we tend to overlook. In a lot of the cases that we've studied of averted mass shootings, so people who plan to do a mass shooting and then kind of change their mind, sometimes even with the gun in their backpack change their mind, it was a human connection to somebody that stopped them. It was somebody giving them a bit of hope, someone asking if they were okay, someone just getting them through that moment. And there's so much that we can do in our daily lives in terms of making those connections. I think the pandemic made us all go sort of inward, and we haven't been out there making those connections. But as we reopen, thinking about, how do I connect? How do I give hope? How do I check in?
All of the above. No, I agree. We look at it, it's the levels of explanation, right? Individual, institution, and societal. And it's recognizing that there's some things we can't do as individuals. Sometimes you do need that heavy lift and a new policy and a sea change in the way we do things. But as I think we have seen over the last few years, people have power, and the people have helped change that conversation and think strategically and differently about violence prevention and what that really entails. And so it's recognizing there are some things we can do as individuals. There are things we can do within our institutions. And then we also need to push for those bigger changes at the societal level as well.
Great. Well, Dr. James Densley, Dr. Jillian Peterson, thank you so much for joining us. This was such an important and critical conversation. I hope everyone learned something. Obviously, you can go to their website, reach out to them and get some more information and download their OffRamp project. And obviously, their book is coming out in September. But we really appreciate your time this morning. Everyone have a great day. Thank you.
Thank you.